think I'm just going to go to Miss Rochelle as a follow-up for that question, to say what resources are available through NAMI, even if someone did not have a plug or an access to mental health care before.
Sure, thank you. I was nodding my head when Dr. Juliet was talking about services. So NAMI does still refer. We refer clients, new clients, old clients. We find them services. And one of the things that we do very well at NAMI is we engage with providers on a one-to-one basis. I find I have friends that are that provide care to patients, and I make sure that if anyone calls me, I make sure that I connect them and say, please, can you reach out and help this client? So because they need care. So we do have referral mechanisms to help people get into care. And can I add something about churches and mental health? Is that okay?
Yes, please.
All right, okay. So many years, well, it's been about 4 years ago, NAMI became engaged in working with churches on providing mental health care, well, providing education and awareness to congregations. And one of our very prominent ministers here in Columbus called me and wanted to attend the family-to-family classes, but he did not want to let anyone know that his daughter was living with a mental illness. And that was the reason that he was going to come to the family-to-family classes. With that, he attended the classes, the 12-week-long classes. He called me and he said, NAMI changed my life. With that, he began writing articles, monthly articles that come out on mental illness and the church. And he writes articles about this. So much so that another minister approached me about his congregation and wanted me to come and speak before his congregation. He invited me actually into the pulpit to talk about mental health and stigma. And I did that. And as a result, he now has written a 12-step program on mental health and the church. And I would be delighted to share that when we roll it out. We engage in what is called the Faith-Based Symposium. We are having one that is coming up. I believe it's going to be June the 27th. And we are going to be engaging pastors and bishops and talking with them around self-care. Because if you don't know already, there are a number of bishops and pastors that have been taking their lives, because of the stress that they can't talk about what's going on with them. So thank you for listening to me on that.
Thank you. That was a great response.
Can't hear you.
Thank you. That was a great response. My name